Hair loss, also known as alopecia, can affect just your scalp or your entire body, and it can be temporary or permanent. It can be the result of heredity, hormonal changes, medical conditions, or a normal part of aging. Anyone can lose hair on their head, but it's more common in men. Baldness typically refers to excessive hair loss from your scalp. Hereditary hair loss with age is the most common cause of baldness. Some people prefer to let their hair loss run its course untreated and unhidden. Others may cover it up with hairstyles, makeup, hats or scarves, and still others choose one of the treatments available to prevent further hair loss or restore growth. Before pursuing hair loss treatment, talk with your doctor about the cause of your hair loss and treatment options. Now let's talk about the symptoms of hair loss. Hair loss can appear in many different ways, depending on what's causing it. It can come suddenly or gradually and affect just your scalp or your whole body. Signs and symptoms of hair loss may include gradual thinning on top of head. This is the most common type of hair loss, affecting people as they age. In men, hair often begins to recede at the hairline on forehead. Women typically have a balding of the part in their hair. An increasingly common hair loss pattern in older women is a receding hairline, that is frontal fibrosing alopecia. Next one is circular or patchy bald spots. Some people lose hair in circular or patchy bald spots on the scalp, beard, or eyebrows. Your skin may become itchy or painful before the hair falls out. The next symptom is sudden loosening of hair. A physical or emotional shock can cause hair to loosen. Handfuls of hair may come out when combing or washing your hair or even after gentle tugging. This type of hair loss usually causes overall hair thinning but is temporary. The next symptom is full body hair loss. Some conditions and medical treatments such as chemotherapy for cancer can result in the loss of hair all over your body. The hair usually grows back. We can also find patches of scaling that spread over the scalp. This is a sign of ringworm. It may be accompanied by broken hair, redness, swelling, and at times oozing. When to see a doctor? See your doctor if you are distressed by persistent hair loss in you or your child and want to pursue treatment. For women who are experiencing a receding hairline, that is frontal fibrosing alopecia, talk with your doctor about early treatment to avoid significant permanent baldness. Also talk to your doctor if you notice sudden or patchy hair loss or more than usual hair loss when combing or washing your hair or your child's hair. Sudden hair loss can signal an underlying medical condition that requires treatment. Now let's talk about some of the causes of hair loss. People typically lose 50 to 100 hairs a day. This usually is unnoticeable because new hair is growing in at the same time. Hair loss occurs when new hair does not replace the hair that has fallen out. Hair loss is typically related to one or more of the following factors. Number 1 is family history, that is heredity. The most common cause of hair loss is a hereditary condition that happens with aging. This condition is called androgenic alopecia. Male pattern baldness and female pattern baldness, it usually occurs gradually and in predictable patterns, a receding hairline and bald spots in men and thinning of hair along the crown of the scalp in women. The next cause is hormonal changes and medical conditions. A variety of conditions can cause permanent or temporary hair loss, including hormonal changes due to pregnancy, childbirth, menopause, and thyroid problems. Medical conditions include alopecia areata, which is immune system related and causes patchy hair loss, scalp infections such as ringworm, and a hair pulling disorder called trichotillomania. The third cause is medications and supplements. Hair loss can be a side effect of certain drugs such as those used for cancer, arthritis, depression, heart problems, gout, and high blood pressure. Another cause is radiation therapy to the head. The hair may not grow back the same as it was before. A very stressful event is also a cause of hair loss. Many people experience a general thinning of hair several months after a physical or emotional shock. This type of hair loss is temporary. Hairstyles and treatments can also cause hair loss. Excessive hairstyling or hairstyles that pull your hair tight, such as pigtails or cornrows, can cause a type of hair loss called traction alopecia. Hot oil hair treatments and permanent also can cause hair to fall. If scarring occurs, hair loss could also be permanent. Risk factors of hair fall. A number of risk factors can increase your hair loss, including a family history of balding on your mother's or father's side, age, significant weight loss, certain medical conditions such as diabetes and lupus, stress, and poor nutrition. We can also prevent hair fall to some extent. Most baldness is caused by genetics, male pattern baldness and female pattern baldness. This type of hair loss is not preventable, but other forms of hair fall can be prevented. These tips may help you avoid preventable types of hair loss. Be gentle with your hair. Use a detangler and avoid tugging your hair when brushing and combing, especially when your hair is wet. A wide toothed comb might help prevent pulling out hair. Avoid harsh treatments such as hot rollers, curling irons, hot oil treatments, and permanents. Limit the tension on hair from styles that use rubber bands, barrettes, and braids. Ask your doctor about medications and supplements you take that might cause hair loss. Protect your hair from sunlight and other sources of ultraviolet rays. Stop smoking. Some studies shows an association between smoking and baldness in men. If you are being treated with chemotherapy, ask your doctor about a cooling cap. This cap can reduce your risk of losing hair during chemotherapy.